Hello everyone, my name is Shamamatul Amber and I'm the consultant in Family Medicine Department and also Associated Professor with the current organization. I will be your course coordinator and your training consultant in the next 4 weeks in our department. A little bit of background about myself. I graduated from med school in year 2002. After having had training in different disciplines, I eventually decided to join family medicine department for various reasons. One of them was a continuity of care for my patients and lots of teaching opportunities. I was involved in informal teaching to start with in outpatient setting with the fellow nurses and medical interns. However, over the time, I have joined several courses and workshops and decided to finally and formally put my foot forward into medical education teaching. I'm extremely passionate about teaching because specifically communication skills during consultations, history taking, exam, and formulation of a shared management plan with the patient is very, very close to my heart. And I'm quite passionate about it. And over the course of next 4 weeks, you would notice that we are paying a lot of focus and attention to this aspect. I live with my husband and 2 children. I love exploring the world and traveling around, exploring different cultures and cuisines. Although I've read your applications and personal statements, however, I would love you to introduce yourself now so that we all know a little bit of background about each other. And specifically, I would like to know what made you to join this course and what would you like to achieve out of these coming 4 weeks. I'm going to pass these index cards. Kindly put your names down and write why you have joined this course and what are your goals and interests. And that would also help us to know each other and have a better understanding of each other's backgrounds. That would help us to see how best we can actually shape up this learning environment tailored to your needs. Thank you so much for sharing the information. May I kindly add that I would very much like you to visit me in person in my office hours in the next couple of weeks. My working office hours are 8:30 a.m. to 4:30 p.m. and you can book an appointment through my secretary, either through email, or you can visit her in her office or give her a telephone call on the extension, which will be provided on the board in the background very shortly. It will also have some information about me, my email address, my pager, and of course, if you have any questions or queries, you can either email me. I aim to reply to my emails within 24 hours. However, if there is something urgent, you might want to contact me through my pager. Or alternatively, you can leave a message with my secretary who will convey the message to me. Let me explain what the next 4 weeks are going to look like for you. So it's a combination of interactive teaching sessions, which contain 4 formal interactive teaching sessions each week in the first couple of weeks, and that is going to be every Monday and Tuesday mornings. You will also be required to attend 5 clinical sessions and you will be attached to a different consultant each day, and you will be sent a rota before the beginning of every week. So make sure that you check which clinics do you need to attend. It is all going to be in the outpatient building, both in the routine clinic area as well as the floor above, which is the urgent care clinics. In each clinical session, the first week you will be required to observe how the consultations are done and how do we communicate, take history, do the necessary examination, and make a shared management plan with our patients. From the second week, during each session, you will be assigned a patient to practice your history taking skills. And after you have completed that, you will present your case to your attached consultant. Please make sure that at the end of each session, you get your logbook signed by your consultant, either on paper, printouts, or electronically, because that is going to add to your attendance, which will be part of the grading system, which I'm going to explain a little bit later in detail. In week 3, instead of the interactive teaching sessions, you will be required to do a case presentation of a real-time patient each, and hence in third week on a Monday and Tuesday mornings, you will be allocated 20-minute slots each to present your case. You might want to choose that as a recorded video or to present it in person, or record an audio presentation, which can be then played during the classroom time. There will be some questions asked about the patient, it would be nice for me to hear a reflection on how the consultation went. In the last and the final week, on Tuesday morning, you will be having an exam which contains 2 parts. It's an MCQs part, which is an online exam, and then objective structured examination, or OSCE, which will be the clinical part of the exam. During OSCE exam, you will have 4 stations with simulated patients, where you will show your skills that you have learned in terms of communication, history taking, and shared management plan with patient. May I kindly request, if you have any further questions or information about this, I will leave this information in a recorded lecture for you with the transcript, of all the interactive learning sessions in first couple of weeks that you will be having. You will be provided with video recordings, transcripts, and will be given links for resources and links to the major guidelines of the chronic conditions that we will be covering, for example, diabetes and hypertension. May I kindly request that whether we are discussing it during class or outside the class, in both formal and informal discussions about patients, that their identity should be strictly kept confidential, and this is very important. Now, a little bit about the grading of the exam. 1/4 will be from your attendance, 1/4 from your case presentations, and the rest of the half, as I already mentioned, is divided between OSCE and MCQ exams. If for whatever reason you cannot meet the deadlines, may I request you request for an extension the day before, so that we could arrange your clinical sessions with the consultants, so that you do not miss on the history taking session, and of course the case presentations, because these are all very important towards your final grades. If you have any further questions, do not hesitate to contact me or my secretary. In a minute, I will give out all the contact details, and I really hope that you will enjoy your stay with us in the next 4 weeks. However, if you have any suggestions or any comments, you are more than welcome to leave it either in writing or when we meet in person in the next couple of weeks. I would be happy to take your suggestions as well. My aim is to make this, help you to make the most out of this course in the next 4 weeks. And I really look forward to working with each and every one of you. Thank you very much.